possible to, screen share? Is that okay with everyone if I do? Awesome.
Yes. Yep, I opened it.
Thank you. So I'm here tonight to talk about Say Something Youth Initiative. The Say Something Youth Initiative is Safe Passage's youth-focused violence prevention curriculum designed to meet the unique needs and strengths of young people in our community, especially LGBTQ youth. Our project aims to promote healthy relationships by giving the EHS community the skills and confidence to say something when they see harmful language or behavior happening in the building or in their community. Our program offers an in-school component and extracurricular component. During health classes, Safe Passage alongside Community Action Pioneer Valley will be delivering an 8-session curriculum about violence prevention during the freshman and sophomore year for students at EHS. Outside of classroom curriculum, we will also have 2 paid opportunities for youth leadership. As Cindy had mentioned, we just completed our first Say Something Youth Initiative Summer Leadership Academy. During that, we had 12 students participate in 2 weeks of programming where students were given the opportunities to build leadership skills, grow community, and collaborate on a social justice project. We are now switching gears and focusing on our advisory group after spending the rest of our summer finalizing our curriculum for implementation this fall. Advisory group is a space where adult youth advisors and Say Something Youth Initiative staff will have the opportunity to come together and meet. The goal of this group is to provide guidance and feedback on the Say Something Youth programming that is happening at Easthampton High School. We'll have 2 cohorts of advisory groups, one in the fall and then another in the spring. During each cohort, we will be offering 10 paid youth advisor positions. And we will have 4 monthly meetings after the youth will be on their own going through a orientation that goes over leadership skills and how to navigate power dynamics and supports youth in gaining advocacy skills as well. Our goal of being here tonight is to let you all know what our next steps are with the project at the high school, and also to ask for support in talking to students, young people in your lives, and also considering yourselves joining leadership, or not leadership academy, or advisory group. We will be meeting monthly after school. Our hope is to be able to meet at the high school, and if for some reason related to COVID or anything else that's not a possibility, we will then switch to virtual meetings, but keeping the same schedule. Sorry, my computer is not cooperating. There we go. If folks have any questions or would like some more information, this is the QR code to our website where you can contact us via email. There is also the link to our website, my email address, and Amy's email address, who is the prevention coordinator at Safe Passage. And she typically would have been here tonight, but she's actually facilitating one of our adult prevention programs right now. We will also be holding info sessions during the month of September, and information about those will be posted to our webpage by the end of this week. The person who typically does that for our agency is on maternal leave right now, and we have to wait for somebody else to be able to do it for us. But by next Monday, there should be information about the info sessions if you are interested in attending those, which will be held virtually. And that's about it. Thank you so much for everyone having me here.
Thank you. Any questions, comments?
If I could just note, thank you to Cindy for bringing these types of programs into our high school. Cindy has been working very hard to bring a variety of programs into the high school. She met with Julianne Levin and I last week, and she's got big plans for the next few years. So I'm really appreciative of her really, making a lot of these programs happen. And this sounds like a great program. So I really appreciate it. Thank you.
Thank you.
You're welcome.
Shannon?
I just wanted to mention last year I was fortunate enough to sit in on one of the groups that we had. I think it was the initial one, wasn't it, Cindy? Yeah, it's a great program. I'm really glad you were able to bring it back again this year. Thank you.
Maren?
Yeah, I just want to say thank you to Cindy and thank you to everybody involved. I think that it's really great to be able to have these kind of opportunities to sort of empower and engage and teach our youth how to be advocates. We've got a lot of major issues happening in the world right now, and we need to have people learning how to be critical thinkers and how to be able to be organizers, and also develop the sort of empathetic skills of working with others to help build bridges and sort of help transform the future. So this is super exciting and 100% support it in any way we can. So thank you so much, Cindy, and for the whole team working on this stuff and all the teams getting involved too.
What I really like is the 10 paid youth advisory positions, because you're training and giving experience to our young people to become leaders. And we need voices, we need leaders. So can never have too many. So I think
Thank
that's
you.
like really exciting part of the whole setup for the program.
It is a very exciting setup, and we're very thankful, thanks to DPH, to have the opportunity. And all the positions in our Summer Leadership Academy are also paid as well.
So all of the students who participated this past summer, they were paid a stipend. We had an amazing group of youngsters, and this program, I just want to let everybody know that this program that's coming to the high school was built with the youth. So it's focused for the youth and it's created by the youth. So I just want to let everyone know that. And Amanda, and there's a few more people, who is Micah from Community Action, and Amy, and also Laura. So I just want to say thank you to them too. They do a lot of work with me and make this easier for me at the high school. So, but it's an amazing program. So any youngster up there, any parent who's listening to us and would like to sign up their child or have want more information, I have a Facebook. It's going to be on the Easthampton website, the date, so they can actually get more information. So thank you so much.
Thank you.
I would also just add, I hope that maybe you guys can have the group come back and do a presentation to us at some point in the school year. Get that opportunity to do some public speaking for everybody, but also just to sort of keep us engaged and informed of who's involved and what they're being able to do with the program. So hopefully you guys can all come back later in the school year and give us more information.
I love that idea.
We would love that opportunity. Thank you so much.
Anybody else? Well, I thank you. We're excited, and we'll be really excited to have you back. So, and the youth. So we'll hear what they have to say. Thank you so much. All right, Dr. LeClaire, back to you.
Okay, and I'm just going to share my screen now. Last time we met, I shared a health and safety guideline document with all of you. I talked about some of the steps we were making, and my recommendation was to have all students and adults masked in the district. You voted on that last time. Obviously, the Board of Education thought similarly to all of us, because they voted to give the commissioner the authority today to have all school districts start with everyone masked. And so I have added some additional information to this document. And for people watching, I'll send this out to families. You don't need to take pictures of it or try to frantically write anything. I'll share this out. It'll be on our district website. It's already gone to the EEA president, but I'll be sharing it out with staff and everyone. So the beginning is similar. Nothing has changed really here. Just a reminder, if you weren't at the last meeting, we discussed as a school committee that we would want to review information on a monthly basis. Our COVID response team would review information on a monthly basis. And by information, I mean latest guidance, trends in Easthampton, trends at the state level, all of those pieces of data that are important for us to make an informed decision. I do want to say that this year, I really want to make an effort to root all of our decisions in the CDC, the DPH, and the Department of Education. Those are our state and federal resources. I think that one lesson that I have learned over the past year and a half with COVID is so many people share so many studies, resources, articles with me. And it's great, it's wonderful. But I think that if for any of us that are following social media lately, you know that for every article on one side, then there's a contradictory article or study on the other side. So I really want to stay rooted in the resources that we depend on at a state and federal level. So the CDC, the DPH, and the Department of Education. So masking, just to help you navigate the information that is highlighted in yellow is information that's been added. So masks will still be required for everyone. We'll have masks available for anyone that comes to our building and does not have a mask. We'll have small ones for children, larger ones for adults. We have all of that. Masks should cover the nose and the mouth and fit snugly. Bandanas and gaiters are not considered safe, nor were they last year, and they're not permitted. So, if families have been using those, just maybe a shift. If you don't have the ability to get the right kind of mask, we'll provide one to you. Vaccinations, we are not requiring them at this time. Again, we'll reassess every 30 days to see where we are. Building ventilation, I would remind people in the community, particularly if you left the district and now you're coming back, we've had an assessment of all of our buildings related to air quality that was done last year. For any spaces that were below the ASHRAE standards, we added air purification units to those areas. We've added more over the summer. For example, in some of our spaces that were not used last year, namely cafeterias, we've added a lot of air purifiers. Safety training, we conduct, Cindy, did you have a question? I'm sorry, and I can only see like 3 people.
Sorry. Can I ask one quick question?
Yes, please.
You have air purification standalone units. Do you know yet if those have been cleaned, the filters and everything inside of them, and they're up and running and ready to go?
The new filters came with, the new air purifiers have the new filters. All our air purifiers that we purchased last year, we have new filters. So it wasn't a matter of cleaning, we replaced the filters in them.
Awesome.
So,
That was my question. I
Okay,
know some
thank you.
people are thinking about that.
Yeah. So we will be doing safety training. That's just help people get navigated to our processes, particularly it will be repetitive for students and staff that were in the buildings last year, but we have a lot of students returning that maybe were virtual last year. So we'll be going over all the safety information again. We'll do it with our staff on September 1st, which is our convocation day, and then expect the building principals to do trainings with students in the first 2 days of school. Distancing, desks will be spaced at least 3 feet apart whenever possible. Lunch, I know we've had some questions about this, and lunch, I mean breakfast and lunch. Free to all students for the coming year. One thing that will look different from last year is last year we had bag meals for the entire year. This year we're going back to our traditional lunches on trays. Inside lunches will be the norm, but social distancing will be part of that equation, and students will be facing one direction and have assigned seating so that we can do appropriate contact tracing if necessary. And yeah, we've spread out students. We've added, in one of our buildings, we added an additional lunch wave to bring the numbers down in a cafeteria at one time. We're utilizing hallway spaces outside of the cafeteria area just to spread out tables. So I think all of the buildings have been very creative. Outdoor options for dining will be available based on weather, staffing, and of course, meal options, because we're using hot meals now. So it doesn't look the same as it did last year. Administration will make every effort to decrease the number of students at lunch and or utilize a larger area for tables and desks to spread students out. Students eating indoors are expected to put their mask back on immediately after finishing their meal, even if lunch is still in session. And students are responsible for disinfecting chair and their table area when they're finished. And then, as was our practice last year, when the students in the next group come in, they may clean the area again. That's what we did in classrooms last year to make sure that spaces were cleaned all the time. Routine COVID safety. Oh, I'm sorry, Maren.
Sorry, if you could just ask a question on that. I just wanted
Yes.
to get clarification. So
Yes.
is that for all student ages are going to be disinfecting? So
It's primarily the older kids. I should clarify that. It's the older kids. I think we did it in grades like 7 to 12 last year. The younger ones, we do have more lunch monitors that are available that are helping to clean the spaces and helping to get kids navigated and pick up around them.
Thank you for clarifying.
Are we still going to be using the tents that we used last year to maximize that when we can?
We have a tent at each building. These are the tents that we own. So yes, well, not at Whitebrook because Whitebrook is a construction zone, but they have the ability to eat outside in the back of the building. So yes. And we still have the yoga mats. They'll be putting, they have some tables and desks to put outside underneath the tents. Tents will be utilized for, as they were last year, if teachers want to take students out for a class, for meetings, any type of activity. So tents will be busy. And I forgot to highlight this area, but I'm going to say it. Routine COVID safety checks. This term replaces pooled testing. So we're doing routine COVID safety checks. And this will be for staff and students that sign up to do it. We will also have the Binax Now rapid testing available for symptomatic students. And we will offer a new program as part of the routine COVID safety checks called a test and stay option, which I described, I think, last time. This is all the same language as last time, which gives students that are identified as close contacts the ability to remain in school and be tested daily. We are following the Mass DPH and DESE guidance around quarantine and isolation. And we are looking to the Department of Public Health for our definition of what a close contact is. The Department of Education and the Department of Public Health define close contacts. We're not creating our own definition. Again, we're relying on science. Transportation, similar to last year, all students will be masked. Windows will be open in normal weather conditions. Students will be seated from the back of the bus forward for contact tracing, purposes, if we need to do any contact tracing for bus students. And otherwise, there's no limits on the number of students that can go on transportation. Field trips, we've made a decision as a district that at this time, outdoor field trips will be allowed, and we'll be asking students to wear masks We'll be encouraging them to do that, but it's not mandated for being outside. Indoor field trips, we're putting a pause on them right now, unless there are really extenuating circumstances, like the We the People group has to go to a competition or something. There's no reason for us to be taking students on indoor field trips at this time. We're going to wait 30 days and reassess all of this. Visitors to the schools. Visitors should really think about whether they really need to come to the building. For families, we're really encouraging emails, phone, virtual meetings, and meetings outside. And student teachers and substitutes, of course, will be allowed in the building with masks. Contractors, mail carriers will be allowed in the buildings with masks. All visitors will have to be masked. And we really want to dissuade people from coming to the building just to do something simple. We have the boxes in front of our schools that we've had for the past year and a half. So if your child forgets their binder at home or their lunch, you simply bring it up and put it in the box and buzz the buzzer and let the office know, and they'll come get it. There's no reason for you to come into the building. So those are some of the updated guidelines. And as I said, we'll be sharing those out, and happy to take some questions. I know you've asked a few, but I'll stop the share now so I can see everyone.
Allison, I have a question.
Sure.
Great policies and presentation. With the review around masks indoors, and so there's the COVID, there's our internal local processing group, and then there's what the commissioner came out with around the same time. So is there an idea that the local group will take in all the information and make a local decision, or follow the state and the commissioner?
So that's a good question, Mayor. And just to review, locally, we have our COVID response team. And on our team, we have the Easthampton Health Department folks. We have Bree, who's the director, and we have the public health nurse. So we work hand in hand with them around everything. They reviewed our guidance. They were with us on making the recommendation to fully mask everyone, 3-4 weeks ago. So I think that we would not be inclined to make decisions without the consultation from the city around what their recommendations might be. I do know that at the state level, the metric that they're discussing now is that if you get to a point by October 1st, where you can demonstrate that you have 80% vaccination, full vaccination for staff and students in a particular building, then you can apply for a waiver. I know from our public health department that we're pretty close at the high school. And so 80% is really good. I'm not sure that as a COVID response team, they're going to be ready to pull that trigger on October 1st. I think there are other factors that will contribute to that information, such as the Delta variant, and how that proceeds. But I think that we'll work hand in hand with the city and let them kind of be the guide as we move forward.
Thanks, Allison. Appreciate it.
Laurie?
Thank you, Dr. LeClaire. I would like to bring up again what has been mentioned before, and many families in the district have begun to question the COVID response team and who would be on it. And I believe that a school committee member should be on it to hear what is being discussed. And I would also request that we use the expertise of the epidemiologist who was so wonderful to volunteer her time. You did say that you want to base the decisions on science, but we have seen repeatedly throughout this pandemic that there have been conflicting reports and conflicting use of the data and scientific interpretations. The CDC, the American Association of Pediatrics, have gone against each other repeatedly. And I won't even talk about the lack of science that DESE has followed throughout. They were very late in jumping on this masking policy and left it up to districts across the state to make the decision, which really was not good that it just came out, this past Friday.
Yes.
And when we used Dr. Megan Harvey as someone to interpret the data, I know as part of the COVID response team, I felt more certain that we were doing the right thing for our community. And I would like to resume that same membership on the COVID response team.
Marissa?
Laurie, I just want to offer a slightly different perspective, and I'm just kind of putting this out there to talk through it. I have an incredible amount of respect for what you and the COVID response team did last year, and the way that you worked with Dr. Harvey, and I know she really volunteered an incredible amount of time and expertise. All stuff I'm very grateful for. I also think we were in a very different situation last year in that we were not getting federal or state guidance. We were really, as localities, asked to make our own decisions. And so in that case, we were sort of forced to come up with our own little team of experts and rely upon their perspectives in order to guide our decision making. But at this point, because we do have state and federal guidance, I'm just trying to think through, given is it appropriate to allow the public district's policies to be guided by someone who hasn't been elected and who isn't employed by the city or the school district when we do have guidance coming from the state and the federal government?
I just feel that often they are conflicting, and I would love to be optimistic and think that we would be able to get the proper guidance and it would be consistent, but I haven't seen that.
I understand that. I just, as from the level of the school committee as a public body, I think it makes more sense for us to defer to the guidance of other governmental bodies as opposed to an individual from our community who doesn't have a formal relationship with the city or the school district.
But as a team, we discussed everything. It was never the decision of one individual. We took the information from everybody. It wasn't that it just came from the epidemiologist, but she often guided. And I would like to also say that we've been very fortunate to have such a wonderful public nurse, but we no longer have her. She has left the district. I'm not sure if everyone knows that Amy Hart has left the district. So especially with that, I would love to still have the people that were on the team be able to continue to make sure that we are guided correctly, because I am not as optimistic as you, and I do not believe that we are going to be getting the proper information at all times from DESE.
So when Megan served, she was serving as a community member, and initially I think Dr. Leclerc, included a community member as part of that decision-making team, just to weigh in and to involve as many different facets of the community as possible. And I like that makeup, whether it's Megan, which would be great. I do think it's important to have a community member, if you can, be a part of the team. It's not a decision-making team. It is a team to look at the information and provide a recommendation. That's just me. I always like as many different heads without getting too unwieldy as possible, because this is still, my concern is that this is a new variant that we're worried about. And my biggest concern with the Delta variant is not the vaccinated people. So that 80% I'm happy about, but they're going to be pretty safe. My concern is the number of children that are getting it and ending up in the hospital. So again, this is a brand new variant that I really wanted to think that our year would be better, and I still think it will be. But I think that a few extra heads here and there, putting all our heads together to come up with recommendations isn't going to hurt anything. So that's just my perspective. Marissa, you were going to say something, I think the mayor was.
I've already spoken. I'll defer to the mayor.
But the mayor just.
I'm sorry.
Okay.
I just wanted to kind of lend support to Marissa's comments. I think we're in a very different situation, and I think that the COVID response group can always be recomposed if we really start to see sharp uptricks or feel like we need the support of volunteer epidemiologists and whatnot. We're outside of a state of emergency on the state, the federal, well, no, federal is our state and local level. We're kind of going back into our groove. And given that this has to do with medical information, I think we keep it to be a tight circle as it is now with employees and staff, with a public report out from the group.
And if I could just add, and this is, I think, to put a pin in what the mayor said, I think it's a little bit different. If there is a mask mandate in the city of Easthampton, all of our adults are wearing masks. It's not up to the COVID group to make a decision. We're kind of, which again is why we're working hand in hand with the city of Easthampton Health Department. When we made this decision a few weeks ago, they were heading into an advisory. It's strongly recommended that you wear masks in Easthampton right now. So, when we talked about it, knowing we have the students, it kind of made that decision easier. So the COVID response team last year was looking at information that was so varied, because we were trying to make recommendations to the school committee about, are we going to recommend closing? Are we going to recommend going into hybrid or opening? There's no thinking that that's on our radar. And I don't disagree that would change the ball game significantly. And I know that someone wrote in about, what are our plans for remote learning? The state is telling us that remote learning does not count at all this year. So it is not part of our plan to do remote learning. Now, if something changes, of course, we will adapt and pivot. But, I think right now, the power on the COVID response team is lessened because there are trends that are going on in the community that are dictating kind of how we're going to operate, what our modus operandi will be, if you will. So I think that's important to know. I would also note, just for the people that are listening in, that besides the folks in Easthampton that are part of our health department, we also have a school physician who's a pediatrician in Northampton, and she sits on our committee as well. So we do have, and we have our district RNs who are all BSNs. So they're with us as well. So we do have a lot of medical opinions already. So I just put that out there.
Anybody else? Shannon? I can't hear you for some crazy reason.
It might be your headphones. Oh, no.
How about now?
Yep, we can
We'll
hear
just
you.
We'll just take those out. So I'm sorry that I got cut out. I was having technical difficulties. But have we talked anything at all about fall sports?
Fall sports are happening.
Are we allowing
We're not in a state of
spectators?
emergency, so what?
So, well, no, I just didn't know if we were allowing spectators to like the volleyball games or whatever.
Yes, we're no longer in a state of emergency. So,
Okay,
I mean,
I just wanted to make sure.
anyone entering our building is masked, obviously, so.
Okay, I just want to make sure. Thank you.
Yep.
If I could just speak to that, I think that ultimately is the decider here, right? Is that the state is not in a state of emergency. The governor has not taken on that authority. There is no guidance for options from the DESE level or the governor's level. So like you're sort of saying, Dr. LeClaire, is that our options are very narrow right now. And that when I certainly also hear that if that changes, if the state takes a different stance, if something opens up and suddenly we have choices and we need to make informed decisions, then we will broaden groups like the advisory group or engage that however we need to engage that once we have choices. But the whole aspect right now is that for better or worse, you know, we have very limited choices at this moment, and we're going into a school year with that level of engagement, which means in-person learning, you know, and we're adding on factors like masks until October 1st when we have choices. So it feels like that's really the guiding piece, is that right now, if we don't have a whole lot of choices, we don't need a broad, you know, collaborative group to be trying to make decisions, because we don't have the authority to make any of those decisions. We're going forward with the guidance that you put forward to us. It's been reviewed by the advisory group. I think it's, you know, it sets the stage for us to be as safe as we can be within the spectrum of what our choices are, which is very narrow right now. So, and we'll, like you said, we'll pivot and adjust if that changes, and if our engagement has to increase because suddenly we have the ability to make different choices and have to have more information. So I think that that's sort of our guiding right now, is that we have to just stay within state law, and that's basically regular school. And we'll deal with it as we deal with it if things change from there. But otherwise, we need to move forward with what's the reality at the state level.
Yeah, Maren, I agree. I would also, you know, in my mind, I just have it a slightly reframing of a very similar perspective, which is not so much that we are at a lack of choice, but that we are this year not burdened with this undue responsibility of being local people trying to make decisions in a pandemic without guidance, which was where we were last year. And so this year we are free from that terrible responsibility that we faced last fall. And instead we have the expertise and the science-based guidance of organizations like the CDC. And I think we are extremely lucky that we live in a community that has taken this pandemic really seriously and has taken a science-based approach. We do not face what some people in other states, school committee members and teachers in other states are facing, where they have people in the community who are denying the existence or the seriousness of the pandemic. We don't have that as a problem in our community of Easthampton. We do seem to have some people who are also skeptical about the CDC and the intentions of the CDC as a guiding body. But I think if we are going to follow a science-based approach, then it does mean trusting the CDC and trusting the guidance that they have offered us. And I know personally, as a locally elected official, I'm very grateful to defer to their expertise over my own. And so I personally feel not like I'm restricted in choice, but rather I'm quite liberated by the fact that we have some really science-based experts who are telling us the safe way to return to school. So I'm very happy to be entering our new year with all that behind us.
It's just unfortunate. It's just unfortunate that DESE doesn't always follow CDC, such as what is the definition of close contacts.
Laurie, is that true? I thought that the DESI one was aligned with the CDC close contact definition. I thought I had read that today.
It's aligned, I know it's aligned to the Massachusetts Department of Public Health, but I'd have to look through.
I believe it is not aligned to the CDC.
Let me look. I think I read.
I'll look.
DESI is 3 feet and the CDC says 6 feet. And that's the continual problem, as I stated before. That we
DESI
face all
says 6
along.
feet. DESI says 6 feet. I have the paper right here.
When did that one come out?
The document was from the Department of Public Health and the Commissioner of Education. It was a memorandum dated August 13th, and it's titled DESI DPH Protocols for Responding to COVID-19 Scenarios for the School Year FY 21-22. And I've read through it all, as has our nursing department.
So I
And
believe
it's on
was a
page
recent
4.
change.
It's on page 4. Yeah, it's dated August 13th, so.
So, I mean, I do know more information is coming. I do feel more confident using CDC information and DPH. I do think that DESI has taken a very slow approach often in terms of getting information out. So that makes me very uncomfortable. But I think if we have, you know, a COVID response team that is just watching the data and giving us the recommendations that they can, we'll do the best we can with it. I will agree, DESI has taken the ability for anything but in person right now. We still have parents everywhere in every city asking if there's still going to be a remote option. And at this moment, there is none. They're just, and it's not a local decision, it's a state decision. So whether or not that changes, you know, I'm really hoping the numbers go in the absolute best way, and that in person is something that we're able to do all year. That's my focus, is just doing whatever we can to keep us safely in school all year. And that's really where my whole concentration lies. So I definitely want a school committee member to be on the COVID response team. I think it's important for us to have eyes and ears in what's going on and have a seat at that table to hear what's happening. So let's, other than that, I'm all set. Anybody else want to say anything? I don't have any concerns about you know, the test and stay is more information coming. That one I think is scaring people. And I think once it's done and we get more clarity, it might feel better. I do think it is going to put a burden on the number of nurses that and the hours that they're doing, because if you're testing a certain number of people every day, but I, like Marissa, feel that our community has a really good chance of not overburdening the system. I think we have very intelligent, thoughtful community members who are going to hopefully do the best thing. I think we've fared pretty well through this thing. So I have optimism, but I am always hoping that we don't have bigger issues. The only other thing, I like the fact that we have the tents. I would encourage us, even if we're using the mats or whatever, to just keep doing as much outside as often as we can. And I know that's what you're going to do, but I know from a lot of people, the lunches inside make us nervous. We're not going to have an option later on when the weather turns bad, but we can do it as long as we can and try to keep keep everything down. So I
Um,
still am hoping for a better year than last year.
And if I could just say something you said that reminded me, we're going to be working this week into early next week on getting the COVID testing information out to families. And we're fortunate we used some of our federal COVID dollars to hire a family engagement coordinator that just started in the district, and it's Jean Libby, who I think is on this call, is in our virtual meeting, listed as Jean. She didn't put her last name, but I think that's the Jean. But Jean is going to be kind of the liaison to get the message out to families, to work on the social media, put a positive light on testing, and really try to answer some of their questions about testing, test and stay. We're really going to try to be thoughtful on the information that we put out to really maximize the number of people that are signing up for testing. In addition to all the other things that we hope to have Jean do, that, but that'll be one of the first things.
I think we did so much work last year that we have enough things in place that if we need to, we can pull them out. We've got a good toolbox.
Mm-hmm.
Anybody else who wants to say anything? No. All right, well then we'll go on to our matters for action.
All right, so I would make a motion to accept the budget transfer request of $58,098 from salaries to medical and therapeutic.
I second that.
Okay, Mayor?
It looks like, Superintendent, did you want to say something about that?
I did just want to tell you what it was. So we had money in a salary line for a position in our special education department, and we have been unsuccessful filling that position by advertising locally and finding someone to hire for the district. So we're contracting that out. So it's moving from a payroll line to a contracted services line. We're going to be working with a company to supply someone. So it's just moving the money for the position.
Thank you. So did we have a second? Yes. So now we'll just roll call. Shannon?
Shannon Dunham, aye.
Mayor?
Mayor LaChapelle, aye.
Lori?
Laurie Garcia, aye.
Marissa?
Marissa Gray, aye.
Maren?
Goldstein, aye.
Cindy Kuzensky, aye.
I make a motion to approve the school payroll dated 8/12/2021 in the amount of $378,373.44.
I second that.
Okay, Shannon?
Shannon Dunham, aye.
Mayor?
Mayor LaChapelle, aye.
Marissa?
Marissa Gray, aye.
Okay, Lori, did we lose Lori?
No, I'm right
Okay.
here. Laurie Garcia, aye.
Oh,
Maren Goldstein, aye.
everybody's switching on me. Maren, aye. Cindy Kuzensky, aye.
Motion to approve the accounts payable authorization for payment dated 8/12/2021 in the amount of $71,518.79.
Okay.
A
Shannon?
second.
Oh, sorry. Shannon,
Shannon Dunham, aye.
thank you. Mayor?
Mayor LaChapelle, aye.
Marissa?
Marissa Gray, aye.
Lori?
Laurie Garcia, aye.
Maren
Maren?
Goldstein, aye.
Cindy Kuzensky, aye.
Motion to approve the minutes from the August 10th, 2021 meeting with the stipulation to withhold executive session meeting minutes until matters are resolved.
Second that.
Okay.
Shannon Dunham, aye.
Mayor?
Mayor LaChapelle, abstain.
Okay. Marissa?
Marissa Gray, aye.
Laurie
Laurie?
Garcia, aye.
Maren Goldstein, aye.
Cindy Kuzensky, aye.
Motion to approve executive session minutes for August 16, 2021, with the stipulation to withhold until matters are resolved.
I second that.
Shannon Dunham, aye.
Mayor,
Mayor LaChapelle, aye.
Marissa,
Marissa Curry, abstain.
Lori,
Laurie Garcia abstain.
Aaron Goldstein, aye.
Cindy Kuzensky, aye. Okay.
Cindy, if I can have something in other.
Yes,
So thank you.
thank you.
One of the things that comes up at the beginning of every school year, definitely this year included, is transportation. I've already taken a few calls on questions around busing and transportation. And obviously, Dr. LeClaire, you already stipulated, that the seats are available, people will be able to take buses. But if people feel like they're, either have questions about it or are outside of the, or inside the markers for different pieces, can you just clarify who the best person and point of contact is to reach out to get additional information to talk to about transportation? And then I'm going to say this just as I've always felt, sometimes we take a very long time. I know that there's a lot of moving pieces to figure out when spaces are still open, but leaving parents sometimes weeks without knowing if they're going to be able to get a placement on a bus is oftentimes really long. So my hope is that the management of this can be just as quickly as possible, being able to add spaces and include as many students and parents as quickly as possible. If you could clarify who the point of contact if parents have questions about transportation. Thank you.
Thank you.
Sure. So just to remind this committee, last year in the midst of COVID, when we resumed in-person learning, we lifted any restrictions on transportation because we anticipated that a lot of families would either keep their children home or find a means to transport their children because of safety concerns of the unknown related to COVID. So we opened it wide up last year, and people that did not necessarily qualify for transportation were allowed to ride transportation. And I think that, of course, is going to be difficult to understand this year why they were allowed to ride on the bus last year, but this year they don't qualify now. So that has been a challenge that we've been navigating in our office. But also I'd like to just clarify something else you said, Maren, about getting things done in a more expedient fashion. So we contract out with Durham Bus Company, who does our routes for us. So we are at the mercy of the bus company to wait for them to give us the information. And we're still waiting on some information from them today. It's difficult. They work in multiple districts, and they're short-staffed, as everybody is short-staffed, so it presents a challenge. The third thing that I would like to say is that our buses are pretty full right now. So I have had, to answer your initial question, who should they turn to if they want to make an appeal? That would be me. So that's part of our policy. People should write an email to me. I'm not approving any right now. The earliest I would probably approve them at this point is early next week. And the reason for that is because even though we had a deadline for people that qualified to ride on the bus to turn in sheets by August 13th, we're still getting people up in our office right now turning in their that they're accepting the bus transportation. So it's not everything is shaken out. Durham doesn't have all the information from us. They haven't completed the routes. Some of our routes are actually, the buses are full. They're done. We can't take another student. So I just really can't approve any appeals right now until early next week. And then there would really need to be extenuating circumstances, not just that it would make people's lives easier. I mean, really, people are responsible to get their children to school, so unless there are really extenuating circumstances, and I hate to say that, I would love to allow anyone that wants to ride the bus an opportunity to ride the bus. It just becomes a factor of we don't have enough buses and we don't have enough runs. Our runs are all stacked up against one another. So it becomes a timing issue as well. So there are a lot of factors that are involved in it. But people should send an email to the superintendent, and there are either one of my email addresses is fine, superintendent@epsd.us or aleclaire@epsd.us, and I'll get back to them within the next couple of days. Does that help?
And I certainly understand there's a lot of different logistics going on there. As somebody who manages logistics, there's a lot of pieces there. So I appreciate that. And as quickly as we are able to help families know those logistics for their side, that would be great. So thank you so much for all the hard work to make that work.
As one other item, can I ask when we might hear some updates on the sort of research gathering process for looking at a later school time for our high school students?
Yes, that's one of the other projects I'm working on. I'm going to be working on with Jean. So I would anticipate that I can talk to you a little bit about it at the next school committee meeting in September to give you a, kind of the lay of the land of how we're progressing.
Thank you so much.
Mm-hmm.
All right, there's no other, Shannon?
All right, I have another.
Okay.
Another. I just wanted to say a huge thank you to the mayor's office, Lindsay Mailer, for helping me out trying to find some fill-ins for the lunch program while Chartwell was shut down. Unfortunately, all the other districts that we did reach out to, with the exception of Springfield, did not have their program running this week, simply because they haven't had a vacation in almost 2 years. So huge thank you to Lindsay. I did want to make a mention that starting 9/3, that there will be community pickup for all children 0 to 18 in our community for Monday through Friday breakfast and lunch, on Tuesdays and Fridays at EHS from 1:30 to 2. And thank you to Dale for getting that coordinated with Chartwell.
Right, that's for students that's for children that don't attend our schools.
Right.
Because they'll be all of our kids will be in school, so.
Well,
So,
there's
yeah.
a lot of kids that are homeschooled now and other situations.
Yeah.
that-
For the ones that don't walk into our buildings, yes, absolutely.
So I just want to thank everybody for their collaborative effort.
Thank you.
I appreciate it.
Any other? Okay, then I would like to roll call into executive session. Marissa,
Marissa Gray, aye.
Lori,
Laurie Garcia, aye.
Maren,
Goldstein, aye.
Shannon,
Shannon Dunham, aye.
Mayor,
Mayor LaChapelle, aye.
and Cindy Kuzensky, aye. Okay, thank you. See you all soon.
Recording stopped.